But that brings up the big question, right? What is actually going on inside the brain that causes these huge, profound fluctuations? That's really the core question we're going to unpack today. So let's get into it.
We're going to break this down into 5 key parts. First, we'll cover the basics. What even is bipolar disorder? Then we'll dive into the spectrum of moods. After that, we'll look at the causes and how it's diagnosed, explore the pathways to treatment, and finally, and most importantly, we'll talk about what it means to live a fulfilling life with this condition.
Okay, let's kick things off with the absolute fundamentals in our first section. What exactly is bipolar disorder? And, how has our whole understanding of it changed over the years?
So, here's the clinical definition. It's a lifelong mood disorder that causes these intense shifts we've been talking about in mood, energy, thinking, the whole shebang. But the really crucial thing to get here is that we're not just talking about having a bad day. These episodes can last for days, weeks, or even months, and they can completely disrupt a person's ability to just function.
Now, you've almost certainly heard the term manic depression. There's been a very deliberate shift away from that term in the medical community, and for good reason. Manic depression was not only less precise, but it also carried a ton of stigma. The term bipolar disorder is more clinical, it carries less of that heavy weight, and it much more accurately reflects the 2 poles of the condition that we're about to get into.
All right, moving on to Section 2. Let's really explore that spectrum of moods. What do those highs and lows actually feel and look like? And what about the periods of stability that can happen in between?
This slide really lays out the 2 poles of the disorder perfectly. On one side, you have mania. This is a state of super elevated mood, almost frantic energy, and racing thoughts that can easily lead to impulsive or reckless behavior. And then on the complete opposite end of the spectrum, you have depression, which is characterized by this deep, overwhelming sadness, fatigue, and just a total loss of interest in pretty much everything.
Now, it's really important to know that bipolar isn't just one single thing, it's a spectrum. For bipolar 1, the defining feature is having at least one full manic episode. And interestingly, you don't actually need to have had a depressive episode to be diagnosed. Then there's bipolar 2, which involves a pattern of major depression plus hypomania. Think of hypomania as a less severe form of mania. And finally, there's cyclothymia, which is a more chronic pattern of less severe hypomanic and depressive symptoms that go on for at least 2 years. So, how common is all this? Well, bipolar disorder affects about 2.6% of the U.S. population. Now, that might not sound like a huge number, but it translates to roughly 5.7 million adults. It is far from a rare condition. So, that naturally brings us to Section 3. If this affects millions of people, what do we actually know about the why behind it, the causes, and the how, that really complex process of getting an accurate diagnosis?
While there's no single, simple cause, researchers generally point to a combination of 3 main factors. First, there is a very strong genetic link. Second, there seem to be some subtle differences in brain structure and the way the brain functions. And third, environmental factors, things like intense stress or a traumatic event, can often be the trigger that sets off the first episode.
And to really understand just how strong that genetic link is, get this. More than 2/3 of people with bipolar disorder have at least one close relative who also has either the same condition or major depression. That makes it one of the most heritable psychiatric conditions that we know of.
Diagnosing bipolar disorder isn't a simple, quick thing. It's a really careful, multi-step process. It always starts with a physical exam and some tests, just to rule out other medical problems that could be mimicking the symptoms, like a thyroid issue. After that, a doctor will take a super detailed personal and family history before moving on to a full mental health evaluation with a specialist.
So, once a diagnosis is made, the whole focus shifts to management. And that brings us to Section 4, the pathways to treatment. And it's so important to understand that this is a lifelong collaborative journey.
A good treatment plan isn't just one thing. You can think of it as resting on 4 essential pillars. You've got psychotherapy, or talk therapy. Then, medications to help stabilize moods. Self-management strategies, like learning to identify your triggers, are absolutely vital. And finally, supportive lifestyle habits, things like regular exercise and a consistent sleep schedule, can make a world of difference.
When we talk about therapy, there are a few different approaches that have been proven to really help. Psychoeducation is just what it sounds like, learning everything you can about the illness. Then there's a therapy called IPSRT, which helps people stabilize their daily routines, sleep, meals, that kind of thing, which is so critical for mood stability. Family-focused therapy brings loved ones into the treatment process. And of course, there's cognitive behavioral therapy, or CBT, which helps people identify and change those harmful thought patterns.
Now, for medication, mood stabilizers like lithium are often the absolute cornerstone of treatment. There's another class of drugs, sometimes called atypical antipsychotics, that can help manage both manic and depressive symptoms. But here is a really critical point. While antidepressants might be used, they are never prescribed alone. Without a mood stabilizer to go with it, an antidepressant can actually trigger a manic episode.
And all of this leads us to our final, and maybe most important section: what does it actually look like to live a full life with this diagnosis? Let's take a look at the outlook when you have the right treatment and support in place.
We have to start with a pretty sobering reality here. Without proper treatment, bipolar disorder can result in a 9-year reduction in a person's expected lifespan. This really highlights just how serious the condition is and why getting help is so incredibly critical.
But, and please, if you hear anything, hear this: with the right treatment, that outlook changes completely. The evidence is clear. Many people who get the appropriate care go on to lead incredibly fulfilling and productive lives. Treatment works. It is incredibly effective.
So just how life-saving is this treatment? Well, let's look at the stakes if the condition goes unmanaged. The risk of suicide can be as high as 20%. Let that sink in. That's 1 in 5 people. And the rate of substance dependence occurring alongside the disorder can be as high as 60%. Effective treatment directly and dramatically reduces these terrifying risks.
So the crucial point to take away from all of this is that while bipolar disorder is absolutely a serious, complex, and lifelong health condition, it is also absolutely manageable. Hope and stability aren't just wishful thinking, they are achievable goals with consistent, long-term care.
And that really leaves us with a final question to think about. Knowing what we now know about the complexities, the risks, and the profound potential for recovery, how can we as a society, as friends, and as family members do a better job of supporting those who are living with this condition?